Here at the Mayo Clinic, we have the Hip Impingement Specialty Clinic, and that's a collaboration of world-renowned leaders in the field of hip impingement. The most common cause of hip impingement is genetic. You're born with an abnormality either on the femoral neck or on the socket. Now, this can be exacerbated by athletic activity.
The hip joint is a ball that sits in a socket.
Now, when you have excessive bone either on the ball or the socket, that can cause the hip to bump into each other.
And then a ring called your labrum that wraps around and helps hold the hip in place. When you sit or bend forward, the labrum gets crushed between the bones.
And that can lead to hip pain, stiffness, and dysfunction.
And unfortunately, we see a lot of times where there's secondary damage in the hip already. So tears of the labrum, damage to the articular cartilage.
Those can lead to early onset arthritis and be detrimental to an athlete long term.
And we'd rather see people early rather than late when there's an injury or a more significant problem that's been going on a long period of time.
Because this can certainly be the first signs of a hip impingement.
A cam lesion and impingement are synonymous.
So we really tried to individualize the diagnosis and then really what the goals are for that particular athlete.
So we start with non-operative management, physical therapy, injections, and if that patient fails, we do surgical treatment.
So we've put together an entire team of surgical specialists that focus uniquely on their own little niche in the hip world.
So everything from minimally invasive surgery that's done through the arthroscope to, in some cases, open surgery.
If we're just dealing with bony impingement, so extra bone, or a labral tear, this can be treated arthroscopically. We go in with small incisions about the size of your fingertips, so we repair the labrum, and then we shave down the bone both on the femoral head and the socket.
We create now three-dimensional models in some cases where we're seeing these complex, issues and deformities, and they really help us plan and target those areas at the time of surgery.
Then we also have software that in the surgery, we're able to check our resection and see if we're taking enough bone and make sure we're not taking too much bone.
One of the most exciting cutting-edge technologies that we're developing here are cell-based technologies to repair cartilage in the hip. And we're just starting the world's first really cell-based single-stage articular cartilage repair trial in the hip.
So patients are usually returning to sporting activity anywhere from 6 to 9 months. We found high rates of recovery, anywhere from 85% to 95% return to sport.
We now have made tremendous gains in improving patients' function and alleviating their pain.